I do think that our approach has evolved over the years, and I think it's safe to say that traditionally providers and insurers have oftentimes had relationships fraught with conflict, combative, competitive, that sort of thing. And ours too could be described that way in the past. However, it was several years ago that we sort of arrived at the conclusion that it probably makes more sense in this new world for us to be more collaborative, more in partnership mode. And fortunately for us, at least with Blue Cross and Blue Shield of Illinois, they arrived at sort of the same conclusion at the same time, thus led to a pretty unique partnership that we have with the Blues. So the relationship has evolved, and I think that's true with a lot of folks in the field today, partnering with payers, not in every market. It seems like all the planets have to be aligned, and at least for us, the planets did align for Advocate and Blue Cross Blue Shield of Illinois. Thus far, we've been very pleased with the relationship with the Blues. We would call it successful. I think they would as well. Now, we're learning as we go along the way, and not everything has worked out perfectly either for them or for us. But big picture, we continue to outperform the market in a variety of all the important factors, the length of stay, the readmission rate, the cost of care, all those things, which allows for the shared savings dollar amount to be adequate, that we can reimburse our physicians and reinvest in our healthcare ministry. So we're very pleased in that regard. I think that the Blues also look at it as a positive. They're doing something with a provider to bend the cost curve, so to speak, the language that's so popular. And I know that they're going to be anxious to see other providers bend the cost curve because they're very anxious to do that as well. So from all intents and purposes, we've been pleased. Now, we know that our relationship's going to evolve. You can only outperform the market for so many years. And so at some point in time, it's got to move to some kind of other arrangement. And we're in conversations today about what that might look like. Is that full risk? Is that global capitation? Those are the kinds of discussions that I think are sort of the next generation. But thus far, we've been pleased, our physicians have been pleased, and it's hard to argue with the results that we've had. We have had a couple of hurdles that perhaps we could have anticipated in advance. Hindsight's always 20/20. The data requirements were probably undersized on our part, and you might have heard Peter talk about it today in the session that oftentimes both parties say, sure, we can do that, we'll deliver A, B, and C, and it turns out that, we're not quite able to deliver A, B, and C. So I know the Blues, if you were interviewing them, they would say that they underestimated the data requirements. A lot of claims data, not a lot of clinical information that ends up being very important. So we've corrected that over time. Our data is much better today. Time lag, another big issue. It's one thing to have the information. Do you have it on a timely basis so you can sort of make corrections, course corrections, and intervene and make improvements? That was a lesson learned as well. So a couple of issues that were stumbling blocks that we're working around, that we're getting around. The thing about Advocate is that we're not new to this. We've been involved in assuming risk for patient care for years, and we simply accelerated it with the Blue Cross arrangement. So we have some experience, have some infrastructure. I shudder to think what organizations that haven't been at it for a while, what they're facing, because, ours is a 12 to 15-year journey. A lot of folks might think, they just started this when, the ACO legislation got passed. Not so. We've been at it a long time. So we've got all the bruises to show for it, but they're past tense. So consequently, great leadership in place, outstanding leadership. But we have discovered that there are some roles and responsibilities that become created, and I'll give you two examples. One is that we've embedded care managers in the private practice, in primary care physician offices. And embedded care managers, sort of new for us. But that notion of putting someone in the practice on a day-to-day basis, working really, really close to the physicians to work with those patients who really need that kind of care. The 5% that are sometimes referred to that might be the most costly. So embedded care managers, new, kind of a talent, not gap, but something we've had to create and sort of fine-tune over time. The second one is what we're just calling physician coaches, individuals who are really more data-focused that can come alongside our physicians, point out opportunities for them to improve their performance. It's all very much data, and our physicians, like most, you give really, really smart people good data, and they will make adjustments. So it's an opportunity for them to improve their effectiveness, improve their performance with these physician coaches. So those are a couple of new jobs that sort of got created as a result of this, and we continue to evolve. So we may end up with a new job next year as well. We'll see how that goes. I think we're going to see payers and providers come together in some very tight partnerships. I think we will see continued friction and conflict in some markets, and probably everything in between. I don't think one size fits all in this new world that we're facing. A lot of it's going to be market dependent. We heard some colleagues today talk about a lot of parity in their market, and therefore they got into the health business, the health plan business. And we have colleagues who basically care for patients in markets where there is one very dominant payer. A little slower to enter into the health plan. That's where partnership may make sense. We've also seen insurers that get into the provider business, and we're seeing that today in various markets, Florida for one, and other parts of the country. So I don't know that this thing, we haven't got it figured out yet, and I think we're going to continue to see all kinds of different models get experimented with, and then we'll probably draw some conclusions after we see the results and figure out what really is the best way to do it. But for our perspective, collaboration and cooperation and partnership seems to make the most sense for Advocate Healthcare. I would say don't underestimate the time that's going to be required. Do not underestimate the infrastructure costs that are involved. And as I said, the data is huge. I think it's easy for me to say because we've been at this for a while, but I think it'd be very difficult to start now. It's sort of like if you're just starting now, it may be too late. So now it's like automatically we got to figure out who we're going to partner with, because I may not have time in my market to build it. It's going to take too long to build it, so now I got to figure out either how to buy it or how to partner with it. Building it from scratch right now, it seems to me that the market's moving very aggressively, and so that may be the appropriate course of action. Every market is different, but boy, the infrastructure costs, it's going to take longer than you think, it's going to be more expensive than you think, it's going to be harder than you think.